Hi everyone, welcome back. Today I'm going to be talking about how you can detect skin cancer or melanomas. Um, I wanted to do this post because I am about to actually become a certified oncology practitioner, and I think, as massage therapists, we have the perfect opportunity to be able to observe changes on our client's skin. And sometimes these may be in areas where they're unable to see themselves. So, if we can kind of mention something that maybe looks a little unusual, it could actually be the difference between early diagnosis and, it being a cancer that then goes on to spread. Now, last summer, when we had a bit of a heat wave, I actually got extremely sunburnt. I am very fair skinned, so I do burn very easily. And, I got burnt sort of so badly just from walking around. I wasn't even sitting in the sun. That I actually still have some marks you can see there from where I got sunburnt. So, and they're still there, nearly a year later. So, the damage is permanent. So let's start by just talking about some facts about melanoma. It remains the UK's most common cancer. There are probably around 130,000 cases of non-melanoma skin cancer every year in the UK that are diagnosed, and around 2,400 deaths, if not more, from melanoma each year. And I'm going to go on to talk about the difference between melanoma and non-melanoma. Now, the rates of melanoma are roughly 1 in 54 people, and these rates are really rapidly increasing, mainly due to ignorance regarding the early signs of melanoma. So hopefully I can sort of guide you to some of those sort of early detection, some of the signs that you'll see, so that you can get this diagnosed early and get it treated. Skin cancer is one of the biggest sort of cancerous causes of death in people aged between 15 and 34. And 86% of cases of melanoma are actually preventable with early diagnosis. So that's why it's so important to detect this early and to know the warning signs, to know what you're looking out for, because if you get that early diagnosis, you can avoid, surgery that can lead to disfigurement. You can improve your prognosis and even prevent death in the cases of melanoma. Now, the important thing to remember is that, skin cancer can occur anywhere on the body, and it's not sort of specific to certain ethnicities or certain skin tones. All skin types can be affected by UV radiation. So what are the main risk factors for this? Well, as I've already said with myself, fair skin burns more easily, it's going to be more prone to UV damage. But also sunbed users and active tan seekers are going to be more at risk due to intense or cumulative damage. And that's why it affects that age group between 15 and 34, because there's still that sort of social sort of you know, younger people still tend to favour that tanned look. They like, you know, they like to sort of just sit out in the sun and tan, and because they, you know, if you look all over social media, that's what's sort of perceived to be healthy. But also anyone with a history of sunburn, which is pretty much all of us. You know, particularly if you've had sunburn in childhood or in adolescence. You know, we could be looking at people who work outdoors, or sports enthusiasts who spend regular, prolonged periods of time outdoors, maybe without protection. And also mature skin, which has accumulated UV damage over longer periods of time, are certainly going to be, you know, at high risk as well. Or anyone who has more than 100 moles over their entire body, again, going to be more at risk. And of course, family history of skin cancer or melanoma is also going to, you know, predispose you to, you know, having problems with skin cancer yourself. So what are the risks of UV radiation? So what some people don't know is there are 3 types of UV rays, all of which are carcinogenic. So we've got UVC rays, which we don't hear about very often, and that's probably because the UVC rays are actually blocked by the ozone layer, so we don't really need to worry about those ones too much. But the other ones, UVA and UVB rays, which you've probably seen mentioned, you know, when you go to buy sun cream, and you want to be buying a sun cream that protects against both UVA and UVB. Now, UVA rays penetrate the middle layer of skin. They contribute to skin burning and skin cancer, and are also responsible for premature aging. UVB rays just reach the outer layer of the skin, but they are still very harmful. They are the primary cause of sunburn and skin cancer. And so in terms of damage, you know, any time that you have sunburn, reddening, blistering, peeling, even just straightforward tanning without any blistering or peeling, these are all clear signs of sun damage, which causes the superficial layers of the skin to release chemicals which cause the blood vessels to expand and then leak fluid. And that's why sunburn is so painful. That's why we get the reddening, and that's why our skin goes very dry when we've got sunburn, because the fluid is leaking from those layers of the skin. So when UV radiation penetrates into the deeper layers of skin, what happens is that the cells become damaged, and, you know, even though the tan may fade, the damage, which we can't always see, will remain. But, you know, we have to remember also, this doesn't mean we should just lock ourselves away and out of sunlight. Some exposure to UVB, you know, even just 15 to 20 minutes a day is beneficial, because it's the main source of vitamin D. Now, therefore, it's important to get the balance right. You know, vitamin D can also be found in some foods, such as egg yolks, you know, fatty fish such as trout, mackerel, salmon, tuna, cod liver oil, fortified milk, some juices and cereals, but the main source is through sunlight. So you just need to kind of, as I say, get the balance right. Now, a hot topic of conversation when we talk about UV damage is always sunbeds. Now, we are seeing probably people using these less, You know, and a lot of the tanning shops are using the spray tans rather than sunbeds, which is great, because sunbeds have been proven to emit around 10 to 15 times the amount of UV rays as we'd find, you know, from the sun at midday or peak time. And it's thought to be the leading cause of skin cancer in younger people. And as we said, you know, the majority of the deaths are occurring in those aged between 15 to 34 years old. You know, even using a sunbed once a month can double the risk of getting a skin cancer. Not to mention the risk of premature aging, sagging, wrinkling and blotching of the skin. So also, you know, even, and a lot of people don't realise this, even if you're someone who goes for regular manicures with, or pedicures, with the gel nails. Now, gel nail varnish has to be cured with UV light, and even that UV light that is used when you're having your gel nails done can be damaging to the hands and feet as well as to the nail beds themselves. So if you're a regular, you know, user of sort of getting your manicures and things, just be aware of this, because as we're going to talk about later, you know, skin cancer doesn't just affect the skin, it can also affect the nail beds as well. So it's just something to be aware of. But in terms of prevention, there are just some really simple steps you can take to really reduce your risk. Now obviously we've talked there about sunbeds and sort of gel nails, so you can reduce sort of, you know, or not use sunbeds at all, and maybe just reduce, you know, if you are a real regular sort of, you know, having regular bookings for gel nails, just try and reduce it a little. But approximately 86% of skin cancer is preventable by, you know, actions such as keeping the shoulders covered when you're out, particularly at those peak times of day. So between sort of 11 and 3, because the shoulders are going to naturally burn more easily. Make sure that you're using at least an SPF 30 broad spectrum sunscreen on any skin that is exposed. And so we're talking a sunscreen that protects against UVA and UVB. Also wearing a wide brimmed hat to shade the face, the neck, the ears, wearing good quality sunglasses to protect the eyes, and where possible just staying in shaded areas during, again, those peak UV hours, so between 11 in the morning, 3 in the afternoon. But in terms of detecting skin cancers, you know, as we've said, recognising those early signs, those early changes in the skin is crucial, because skin cancer is rarely painful. So we don't, you know, quite often we'll just go to the doctor when something hurts. But, you know, this can really, if you don't acknowledge those changes and you don't just get them checked out, it can really get a lot more serious. Now, there are two types of skin cancer. So there is non-melanoma cancer and there's melanoma. Now, non-melanoma are certainly a lot more common, but melanoma is more deadly and can spread quickly, forming new cancers around the body. So again, early detection is so important. So first off, we're going to talk about non-melanoma. So that's the more common one. And there are two types of non-melanoma. So we've got basal cell carcinoma and squamous cell carcinoma. So first off, we're going to talk about basal cell carcinoma. Now this is the most common type of skin cancer, usually occurring on areas that are exposed to the sun. So we're talking like the head, the face, the neck, the ears. It's slow growing and rarely spreads elsewhere, and it can be different shapes and sizes. But if it is ignored, it can grow large and it can become quite disfiguring. So even though it doesn't, tend to spread elsewhere, it's still important to detect it early, because, it could actually have quite a dramatic impact on your appearance in the long run. So in terms of symptoms, we're looking at a persistent sore that doesn't heal, maybe a pearly shiny bump or nodule, or a pink growth with a rolled and slightly elevated border. It could be a patch of reddish irritated skin, or a white, yellow or waxy scar-like area. So then we have squamous cell carcinoma, which is the second type of non-melanoma. This is the second most common form of skin cancer behind basal cell carcinoma. It usually again occurs on those areas exposed to the sun, so the face, the neck, the ears, also the forearms. Again, it can be different sizes and shapes, and it does grow at variable rates, but it will rarely spread unless ignored. It can cause discomfort, and again, like basal cell carcinoma, if it's left and ignored, it can become disfiguring. But also, the difference between this and basal cell carcinoma is that squamous cell, if it's ignored, it can become life-threatening, even though it's classified as a non-melanoma. So symptoms of squamous cell carcinoma, again, persistent, thick, scaly patches that may bleed. They may look like warts with a crusty surface, possibly small, hard, white or skin-coloured lumps, a persistent scaly red patch with irregular borders, maybe an elevated growth with a central depression, or it could just be an open, crusty sore that bleeds. So now let's move on to melanoma, which is the more deadly form of skin cancer. Now this can occur anywhere on the body, and the appearance of melanomas can really vary considerably, as you can see from this picture. Now melanoma will usually appear either as a new mole or an existing mole that changes in appearance, and if not treated early, melanoma can spread to other areas in the body, and it's difficult to treat and it can be fatal. So in order to detect melanoma, we look at the ABCDE rule. So with this, we look at the affected area of skin, we look at asymmetry, we look at the border, we look at the colour of the skin, the diameter of the affected area, and how it is evolving. So the first specific type of melanoma that we're going to talk about is something called nodular melanomatis. Now this is the most aggressive form of melanoma, accounting for approximately 20% of cases, and it doesn't follow that ABCDE rule that we've just talked about. And it can be actually quite, a lot more even in terms of shape and colour, which could make you think it's nothing to worry about. By the time it's diagnosed, which is usually when it becomes a bump, it's usually invasive by that time. So again, it's so important to know those signs to be able to detect it early. Commonly, it will occur on those areas exposed to the sun, such as the head, the neck, the torso in men, and legs in women, but it can appear in other areas of the body. They tend to grow fast, downward, and can become invasive within months. So this really is a rapidly spreading cancer. Usually it will be black, but occasionally, they can be blue, grey, white, or even brown, tan, red, or skin tone. Now, as we've said, this type of melanoma does not follow that ABCDE rule. So instead, we use the EFG rule. And this is where we look to see, is the area of skin elevated? Is it firm? And is it growing? So a general checklist that you can use, for any sort of irregular sort of change in your skin, and certainly for this nodular melanomatis, you're going to be looking for a mole that changes shape, particularly if it gains an irregular outline, a mole that changes colour, usually becoming darker, patchy or multicoloured, a mole that is getting larger or growing quickly, if it starts to itch, bleed, become painful and inflamed or crusty, or any lesion on the skin, lips, genitals or nails that behaves differently to moles or lesions elsewhere on the body. Any of these apply, just get it checked out. Now, obviously your first port of call is going to be with the GP, but as I'm going to go on to explain, not all GPs they're not always particularly clued up on the early detection signs of skin cancer, but we'll talk about that, a little later on. Okay, so that's the most common form of melanoma. Now, another form is something called acral lentiginous melanoma, and this is located on the palms of the hands, the soles of the feet, which are areas that a lot of people don't expect, that you would get skin cancer, because these areas don't really tan. It's the only type of melanoma that occurs equally across all types of skin and all ethnicities. It can quickly become invasive compared to other forms of melanoma, and it will often appear as a black discoloration, but may present as grey or light brown. The ABCDE rules of melanoma apply to this type, and a flat patch of discoloured skin that gradually enlarges is a classic early sign of this type of melanoma. And so then finally we have something called subungual melanoma, and this is where you people who have regular gel nails need to just be careful, because this type of melanoma begins in the nail beds as opposed to in the skin. Symptoms may include a dark band, usually which is vertical and so will run down the nail, which slowly expands. It could be a dark nail pigmentation that will spread to the surrounding skin. Maybe there's a nodule underneath the nail. Usually it just occurs on one nail, and you may also notice brittle and cracked nails with pigmentation, possibly with bleeding. So that is, you know, your main early signs of each type of non-melanoma or melanoma. Now, as I said, not all GPs are sufficiently trained in the detection of skin cancers, so it's not uncommon for these to be misdiagnosed. So if you are concerned, by all means go to your GP, but ask for a dermatology referral, because, you know, obviously a dermatologist is going to be a lot more qualified to recognise those early signs, you know, and get things treated. Now, if you are concerned, you can also access the Masked website online for information. So that's MASCED. They have lots of information on there: sun safety tips, early detection advice. You can get a self-examination body mapping chart, a mole ruler, and various other educational resources. So it's well worth taking a look, you know, at that site. But hopefully I've given you a good overview of how to detect skin cancers early, what to look for, and, you know, when you need to just get a little bit of extra help from someone who is qualified. As I say, if you're a therapist, you know, you are in a perfect position to recognise these changes in your client's skin, and, you know, just sort of point it out without panicking your client, but, you know, just suggest that they might want to get it checked out. So I hope that's been of some help. As always, do feel free to subscribe to my channel. There are lots of other videos on various topics on there, both medical and sports related, and do feel free to leave comments down below. You can also contact me if you have any questions or queries through my Facebook or Instagram. I'm on there as the Medical Massage Lady. And if you are a therapist who would like to do some training, do take a look at my website, www.medicalmassagelady.com. But that's really all from me for now. So thanks for watching, and take care. Bye.